Ankylosing spondylitis with Anderson lesion and inflammatory discitis. Hello everyone. This is a 42-year-old male patient with chronic inflammatory back pain and kyphotic spinal posture. MRI of dorsal spine revealed multiple discovertebral hyperintensities. Sacroiliitis joint showed classical imaging pattern of spondyloarthritis with narrowing of the joint space and decreased joint space with occasional hyperintensities. There is exaggerated dorsal kyphosis with mild anterior wedging of D12 vertebral body. This is not looking like a traumatic wedge collapse. It's a part of chronic inflammatory spinal pattern. Along with anterior vertebral margins, there is flowing marginal ossifications. These represent inflammatory enthesopathic ossification and syndesmophyte formation rather than ordinary degenerative osteophytes. The vertebral corners show inflammatory changes suggestive of Romanus lesions. These classic corner inflammatory lesions are seen in ankylosing spondylitis. There is discovertebral inflammatory involvement with signal abnormality across the disc and plate interface. This consistent this is consistent with Anderson lesion, also called inflammatory discitis or discovertebral lesion, in a setting of ankylosing spondylitis. This is important because Anderson lesions can mimic infective spondylodiscitis. However, in this case, background features are strongly favoring for inflammatory disease, especially anterior flowing marginal ossifications or anterior longitudinal ossification, giving a typical appearance. The sacroiliac joints show severe bilateral sacroiliitis, anchoring the diagnosis of, and we need to evaluate the HLA-B27. So final diagnosis is ankylosing spondylitis with severe bilateral sacroiliitis, active Anderson lesion presenting as inflammatory discovertebral discitis. The key teaching point is simple. In a young middle-aged male, chronic inflammatory back pain, kyphosis, sacroiliitis, Romanus lesions, and Anderson lesion, think of ankylosing spondylitis before labeling it as infection. Recommend ESR, CRP, and HLA-B27 correlation.